This is the Medical Freedom March, and there are about 40 people out here holding signs. I am going to let them explain why they are out here. But first I'm going to read a statement sent to us by Froedtert. So bear with me here a second. This live broadcast is brought to you by American Commercial Real Estate. So Froedtert sent a statement that reads, Froedtert Health respects the right of staff and providers, to engage in activity protected by federal law. We have implemented a mandated vaccine program based on our belief that such a program is necessary to provide a safe environment for our staff and providers and for the families, patients, and the diverse communities we serve. And that was signed by Rita Schutz from Froedtert. And we're just going to go down the line here and see if anybody has a comment. Yes, you were. Your name, I'm going to ask you your name.
Okay, my name's Deborah Rochelski. I'm an employee at Froedtert Medical College of Wisconsin in West Bend in the Cancer Center. And I just feel that at this point, I don't feel like our employer is living up to the values that they expect us to live up to. The mandate is not allowing any kind of consideration for people with medical conditions other than being allergic to the drug. I showed up as a hero a year and a half ago. When managers were out with COVID, when coworkers were out with COVID, and at one point when there wasn't any masks and we were told we didn't have any for us, I showed up for them. And where are they for me? I have lupus, I have an autoimmune disorder. Getting the vaccine could be so detrimental to my health, and according to their medical exemption form, you're only allowed exemption if you're allergic to any component of the drug. So here I have been a faithful employee, living up to their values. And at this point, they're letting down all of their employees who stood by their side through this epidemic.
Thank you very much. We're broadcasting live on Paradise Drive here in West Bend. There is a mandate by some healthcare facilities mandating the vaccine, I believe, by the end of the month. So there are about 40 people here on site with signs. You can read some of the signs. And I think you wanted to talk. Your name is?
Tiffany.
Tiffany. And are you a healthcare employee?
I am not.
All right. What's your sign say? All right. And your thoughts?
Well, I am a Christian, and the Bible clearly says that we should not only look to our own interests, but to the interests of others. And I'm concerned for the others right now, for these medical workers who've already sacrificed so much to work during COVID, and now we're not giving them freedom to choose. And so I think today I was honoring that. I kept thinking of that verse today, that this might not be a medical worker, but I appreciate them, and I want to honor them for what they've done for us so far. But this is not.
All right. Terrific.
I heard you saying that there were about 40 people here.
Yeah.
There's about 40 people from the corner to this tree over here, and that's only about a third of the way down. So there's well over 100.
All right. Thanks for correcting me.
Thank
All
you,
right.
Judy.
Sure. Hi.
Hi,
Your name is?
Cindy Shizeski.
Are you in healthcare?
I am not.
Are you from this area?
I am. I live in West
Okay. And you had a thought?
These vaccine mandates are absolutely ridiculous. The vaccine is not needed as we have known treatments for COVID, and the treatments have been suppressed and censored by the media and by some in the medical industry. And without those known treatments, that's the only reason why the vaccine was given EAU authorization. And as far as FDA approval, it means nothing, since if you take the jab, you can still get COVID, you can give it to other people. And the FDA has approved many things that have
been deadly, like smoking, and a multitude of drugs that have been pulled from the market. There are many people on VAERS and other sources who have been injured, some minorly, some very severely, and many have died after taking this injection. I would not support this at any level, let alone mandating it.
So I'm pretty super local media. How come I haven't been hearing about that?
You have to get on the right media. If you go on Telegram and follow people like Stu Peters, Dr. Jane Ruby, Dr. Tenpenny, Dr. Robert Malone, there's many doctors who are speaking out against it. It's more than the 12 that Facebook and the Biden administration want to say it is. There's a lot, and a lot of them are afraid to speak out because they don't want to lose their jobs. And to me, in my opinion, this jab is all about the money. Follow the money, and you'll find out what it's about.
All right, thank you for your time. One more. Hi, your name?
Cindy Sheeman.
Are you in the healthcare field?
I am. I've been a nurse for 25 years.
So a couple quick questions, unless you have a statement to begin.
Nope.
Many in your group were waiting for this to be FDA approved. And now I understand the FDA has approved the vaccine.
Well, I'm going to talk about FDA approval. I have a source, Dr. Robert Malone, who was one of the inventors of the mRNA technology, who has gone on live statements saying that we are basically being given a bait and switch. The medication Comirnaty, or I'm not exactly sure of the pronunciation, that was approved by the FDA, is not even available for vaccination in the United States. We are not getting that vaccination. The vaccinations we are being given have not been approved by the FDA. The FDA approval is for this specific vaccination, and that's available in Europe and not the United States. And that is a statement given by Dr. Malone. Now, that being said, I don't think it's even about FDA approval. At least it's never been that for me. For me, it's been about being mandated to do something that I don't want to do to my body. I don't want the vaccination. It didn't matter to me that it was FDA approved or not. I don't think I should be mandated to get something I don't want, especially when it's in an experimental phase.
What about the fact that people are saying children got smallpox vaccines and for polio? They received those. Why not this?
It's a very different number of people that we're talking about. First of all, COVID is dangerous for a certain group of people. And COVID has been proven to be deadly for people, but not in the amounts that they're telling us. And I think there's a big push of fear by the government that is trying to make us all believe that if we get COVID, we're going to die. It has a 99% survival rate. So yes, if I get COVID, I'm not happy about that, but I don't believe I'm going to die. Okay, and so why should I put this in my body? Why should I force my children to put something experimental in their body? I have a 14-year-old son. I'm not letting him be vaccinated either. When he's an adult, he can decide that for himself. But I'm not letting him put that in his body at this point because I don't believe he will die from COVID.
If you're in healthcare to care for people, why not just help the situation and get the...
CDC statistics are showing even people that are vaccinated are carriers of this, Delta variant especially, okay? So all the people that are working in the hospitals right now and are vaccinated and are thinking that they're exempt from keeping people, they're going to keep people safe because they're vaccinated, they're carriers too. So what is the point of being vaccinated?
Thank you for your time. Just going to make our way to the end of the line here. How's your turnout? I was corrected before.
It's better than it was last week, so the message is getting out there and people are taking a stand for their freedoms, which is amazing.
So the question, can I get your name again?
Yes, Joan.
Joan, one of the questions, and are you in healthcare?
I am, yes.
Why not? How do you like this response?
It's mainly positive, so I know we're not the only people who are fighting for our freedoms.
What happens if you're in the medical industry and this deadline comes with some of the medical providers?
I know a lot of staff will be walking out or let go, and I know a lot of people have backup plans for what they plan on doing to preserve their livelihood. Yep.
Why not just get the vaccine? Why not just comply?
We could comply, but complacency leads to the removal of freedoms, and we're in America for a reason. We have the personal choice to make our own medical decisions, and that's one of our rights.